Hello there, I'm Dr. Cece and welcome to my skin clinic. Today I'm going to be doing an assessment of your skin, and that will involve me discussing the different skin types and just offering some advice that is personal to you and your skin. So let me just get up your notes from when we spoke briefly on the phone. Okay, right, here we go. So today's date is perfect, right? Just start a new note section. Great. So you've been having some concerns about your skin. Okay. Yeah. So, how long have these little issues been bothering you? Okay. I understand. So, would it be fair for me to say then that you have flare-ups? Okay, so it's not something that's consistent, it does go up and down. Okay. So to me, that's quite a good thing because it shows me that there must be something triggering it. Okay. Right. And your skin when you were growing up, how was it then? Okay. So average, yeah. It's very, very common to suffer with very bad skin, especially when you're going through puberty in your teens, right up into your 20s really. It's very common to have very, very unsettled skin because your body is going through a lot of different changes, so that is quite common. But what we want to try and do is, as we learn more about our skin, it's good to continually just make notes at what triggers our skin. So I'll be talking more about that in a moment. Now you mentioned about spots. Okay, how frequent are those for you? Yeah. Okay. And do they occur at the same time as the other flare-ups? Okay. Right. So I think the best thing to do is for me to start having a feel and a look at your skin. Is that okay? Great. Before we go ahead, I just need to get your consent. Okay, so could you sign just here for me? Yep, just on that line there. That's perfect, thank you. Okay, let's pop that down. Now, obviously my hands are all nice and clean with bacterial gel, and I do this because some clients prefer that I don't use gloves during examination. Some people just don't like them. Other people are actually allergic. So do you have a latex allergy at all? You don't. Are you happy for me to use the gloves? Great, okay. They are very thin, so they still allow me to feel the skin properly. They just give that added protection. Okay. I bet you're secretly glad that you're in here today. With the weather outside. I know. It's hardly summer weather, is it? No, it's not good. So I just want you to completely relax. This is not a sort of formal examination. I'm not going to be probing anything. So it's just me going around your face, just assessing and having a little look. Okay, so I'm going to come just a tiny bit closer. Okay, so let's just have a look down here. Okay. Have you been to see a dermatologist before? No, okay. Well, what normally happens is I'll just go around and just feel and assess your skin, and then I'll just talk to you about the different skin types, and we'll see where you fit in. And then we can discuss some treatment plans. Okay. What a lot of people can do is they can leave their skin problems for too long, and they can try to self-treat, and dependent on what type of products you're using, this can be fine as long as you do your research. But you know, we can find that it can make the problems worse, especially if you're using products that just aren't right or are too harsh. I'm just gonna feel just down your neck just a little bit. Do you ever get spots under here? Okay. Just, okay. Let's just continue to feel around. Just come a little bit just to the side. Okay. Okay, just checking the jawline. Let's just check just nose area, just here. Okay. Let's just on the side there. Okay. Okay. I've got a general idea about what I think is going on with the skin. So, what I think is happening is I actually can see that potentially there is an overuse of product. Okay, so by doing that, you are almost stripping the skin of all of its natural oils. Yeah, so what's happened here is it's still staying oily, and then you've got real dryness around the nose area and some redness as well. You've also got some redness and flakiness around the chin area and a few spots as well. You've got a couple of spots here, and then again in this sort of, it's quite a fatty portion of the face, just here you've got some spots as well. So what this tells me is that the the cleansing routine at the moment isn't right. It can also tell me that where the spots are actually placed, there could be a couple of different reasons why they're appearing there. Okay, so let me just take the gloves off just for a moment, just so I can just make a couple of notes. So on here we have diagram of the face. Okay, so the face maps into different areas, and the areas where you have your oil, more of the T-zone area, is very, very common. Okay, and then to have spots in this zone here, again, very common. Now the spots on the cheeks, they can be due to a couple of different things, but one of the most common things really is just not keeping your hands nice and clean. So you're sitting there touching your face, even when you're quite unaware that you're doing so. Another reason can be is that if you have anything like a chesty cough or a cold, you will tend to get a few spots here, and that's just your system kind of working things out. It comes from Chinese face mapping, and these areas here are quite affected by our lungs and our chest. Okay, have you had any issues like that? It's probably the hand washing. So really simple tip is to just purchase a really cheap little hand gel. Okay, so you can pop it in your bag when you're going out, you can pop one by your bed as well, and just make sure a few times a day, you don't have to be obsessive over it, but when you've eaten, or especially before you've eaten, after you've eaten, and just any time of the day where perhaps you've been in a shop and you've used a card machine, anything like that, remember that your hands will transfer anything you've been touching onto your skin. Okay, so you can pick them up really inexpensively. I'm talking, literally hardly anything at all, and you can use that whenever you need to. Okay, perfect. So I'm going to write that down, that you're going to purchase one of those, and gel. Great. So the other areas that you're getting the spots along this kind of point, that can be down to hormones and stress. Okay, so have you had anything recently that would make you feel particularly stressed? Okay, sure. I think a lot of the sometimes we are unaware of how much stress is actually around us until we step away from it. So it can be a tricky one, because when we have skin troubles and when we have spots, we can make ourselves feel more stressed. It's really easy to do, and through that stress from feeling stressed, we create more spots. Not good. So what we need to learn to do is we need to learn to de-stress ourselves. Now, obviously there are very natural ways in which we can do this. So we can try things like meditation and yoga. Exercise is great for de-stressing. Things like going on a walk, and just things like taking time to do things that you really enjoy and bring joy to you, so that you don't have to focus on all the stresses. Now, if you're doing all of that and you're still feeling quite stressed, a great supplement to try and take is either a multivitamin, because it's going to feed your body with all the nutrients it needs, but also a really good B vitamin and magnesium. Okay, so magnesium is particularly good at helping to relax the muscles, but generally speaking it's really good, especially around hormonal times, just to really help to just de-stress and relax. Okay, so I'm gonna just make a note that supplements have been discussed. Do you take anything at the moment? Okay, yeah, that's fine. So I would recommend them the magnesium, just if you are feeling really stressed and overwhelmed. That's something that really can help. Okay, but if in doubt, always consult with your doctor. Okay, and just make sure that it's not going to conflict with any other medication you may be taking. Okay, good. So now the flakiness we discussed in this zone just here, again, that is because the skin isn't balanced. So the dryness here and here, what's happening is the products that you're using, as we said, are stripping the face. Sometimes it's causing too much oiliness, sometimes it's causing too much dryness. So we need to find a solution that's going to really help just meet in the middle and just solve those problems. Okay, so it is possible to do, but it does take time, so patience is needed. Now I'm going to just share with you the Fitzpatrick skin scale. Okay, have you ever heard of this before? No? Okay. Now, I just want to show this to you because I noticed that, have you just sat out in the sun a little bit or been on holiday? Okay, because I can just see here just a little area of pigmentation. Okay, so that is caused by, overexposure to the sun. So the Fitzpatrick skin type scale is really important to remember. So type 1 is your light pale white skin, and this always burns and never tans. The type 2 skin is white or fair, and this usually burns and tans with difficulty. Then you have your type 3, which is the medium white to olive type of skin tone, and this burns mildly but tans gradually. Then you have your type 4, which is your olive and moderate brown skin colour, and that rarely burns and tans with ease. Your type 5 is your brown or dark brown, and this very rarely burns and tans very easily. And lastly, you have your type 6, which is black or very dark brown to black, and this never burns and tans very easily. So the reason why I wanted to show that to you is because once you know your skin type, although this is largely to do with, sun exposure, once you know your skin type, it's actually really handy when thinking about products. So I would put you in this sort of type. Okay, so what we want to do is just make sure that we're looking after the skin as best we can. So this is the other chart that I want to show you, and this is quite handy because this is relating to after you've washed your face and waiting an hour, this is how the skin is reacting. Okay, so after you've washed your face, an hour later your skin feels itchy and tight and has some flaky patches. Your skin is shiny, feels greasy, especially in my T-zone, is oily in the T-zone, but dry or normal on the cheeks and the jawline. Feels good and even, not too oily or dry. Sometimes gets red, irritated, itchy or inflamed. So thinking about this, which do you relate to the most? Yeah. Okay. So you're really looking at the combination skin then? Yes. So that is, my assessment for you anyway. Because you have some dryness, but you've still got that oiliness, that is typical combination skin. The good news is that that is a very common skin type. It's actually quite rare for somebody to have just completely, normal skin that's very balanced, especially when we got the influence from pollution and things like that can all affect our skin. So let me pop my gloves back on. Now, firstly, can you see this redness here? Yeah. So that is from a product that is really not agreeing with your skin. Okay, so what do you use to moisturize or cleanse your face? Okay. So salicylic acid is great for, I feel, more topical use, and it's really good in particular areas. The trouble is when it's put in things like washes and even wipes and used all over the face, it can really make the skin really, really sensitive. Okay, so it's almost stripping off your face and your skin, and it's leaving it quite raw and irritated. Even though it can help with spots, it's not great for the overall skin texture. Okay, so what I'm going to recommend to you is to go back to basics. So this will help to calm down the redness around here, and what I want you to do is I would like you to wash with a sensitive soap and water. So that is really, really taking it back to basics. Now I'd like you to do this every morning and every evening, okay? Now if you have anything else on your face that you need to remove, you can do so either with a sensitive makeup wipe. I would try for the moment to stay clear of the micellar waters, just because they are great at removing all of the dirt and makeup and things like that. The trouble is that they can almost over cleanse and it can bring out more impurities. Okay, so just keeping it really simple. Now, the next thing I'm going to suggest is that you use an oil-free moisturizer. So when people have spots, what they tend to do is they will tend to overload the products, try to do as much as they can to cover them up. Really, they need to be let to breathe, but also you need to moisturize the area still. So with things like when spots get to more of a scabbing over stage, what can happen is that area is really dry, and if that little patch just breaks off, that's what can cause scarring. So if you actually moisturize the area with an oil-free moisturizer, you're going to be keeping that skin nice and moist, and it's going to heal much better. That moisture is also going to be really great at helping in the dry patches. Okay, types that you could use. So there are lots and lots of drugstore oil-free moisturizers that you can use. They range in price from a few pounds upwards. Okay, you don't need to spend a fortune at all. All you need to do really, if you're in doubt that it's oil-free, turn it over and look at the ingredients on the back. Literally, if you can see anything that mentions oil, it's not oil-free. Okay, normally it will say it on the front of the packaging. If you are in doubt, you can also ask over the pharmacy counter to see if they have anything, or look online. But normally you can seek one out in a shop. Okay, now we don't want to overdo it. Okay, so once your face has been nice and cleansed in the morning, I just want you to pat it dry. Okay, so no harsh wiping, no exfoliating, so that means no exfoliating gloves, no scrubs, no harsh use of things like flannels or towels, just dabbing and patting the face dry. Then waiting for your skin to cool down after you've had a shower or you've washed, and then applying the moisturizer just lightly over all of the skin and the neck. Okay, so you have got a few spots around here, and as we said, that's triggered by stress. So I'm going to try and work on that. Now I'm going to recommend a topical cream. Okay, I have two options. It's either a topical gel cream, or you can use a oil. So you can use tea tree oil, which is natural. Okay, so tea tree oil has great antibacterial properties, and what you can do is you can take a little cotton bud and you can dab it in the tea tree oil. Look for one that is blended, because the pure ones are very strong, and you would simply dab onto the individual spots and just leave it alone. It will help to reduce the size, but also make sure that the area is nice and clean as well. The other option that we can talk about is Acne-Side. So Acne-Side is a topical type of cream, and I would only personally recommend applying it at night to start with. You could, if you were putting nothing else on your face, apply it in the morning if you wanted to, but this you have to be really careful with, and you just dot it on the spots, and it really helps to just dry out the spot and just stop things from spreading. Now I recommend that to you because you haven't got a lot of spots, so I wouldn't recommend to you a course of steroids or antibiotics, anything like that. We could try a topical clindamycin 1% gel. You can use that as more of a kind of all over treatment, but again your spots are more individual and spread out, so I feel you're going to be much better with more targeted treatments. What do you use on your spots at the moment? Okay. Okay, so you use that wash and then the witch hazel. Okay, so witch hazel is really good. It's really good. It depends what type of blend it's in. When are you applying that? Okay, so that's a little bit too much. I think the trouble is, again, is when we want spots to disappear, we overdo things a lot. Okay, so again, we're going to be stripping everything back to basics. Okay, so what I would recommend is around these areas that are a little bit extra dry, you could put something to top up during the day, like Vaseline. Now, obviously that is quite greasy and oily, so if you apply it just to these areas and here, you want to make sure that you wash your hands and apply that hand gel so that you don't transfer it to the rest of the face. Okay, so really the hygiene is the most important thing. It's something that a lot of people do kind of take for granted, so you need to make sure that your hands are staying nice and clean. Okay, now let me take these off, and what I want to do is I want to discuss with you your diet. Okay, because there are a couple of little red flags with your skin that I think could be down to diet. So, could you just give me a brief overview of the types of things you would have in a week to eat? So let's start with breakfast. Okay. What type of cereal is that? Right, okay. And do you add sugar to that? Okay. And to drink, what would you normally have? Right. And would you be drinking that again throughout the day? You would, okay. And what about for lunch? What type of thing are we looking at? Okay. Is that just quite a rare thing, or is that quite a regular thing? Okay. Do you have any sauce with that? Okay. And the kind of drinks around lunchtime? Okay. Yeah. And what about your dinners? Yep. Oh, that sounds nice. I could eat that right now. Okay, what else? Yeah. Do you enjoy cooking? Yeah? Okay. And your evening drinks? Yeah. Okay. And what about snacks? Right? Yeah, I know, they are good. Okay, so this is kind of an average week for you. Okay, so let's start with the breakfast. So you're having not only quite a lot of dairy, but also quite a lot of sugar. Yeah, so you're probably not aware about how much sugar the cereal itself contains. So do you do any portion control? Just sort of dip it in the bowl. Okay. So what I want you to do is, if you still want to have the cereal in the morning, then I want you to make sure that you're measuring out just one of the recommended portion sizes, because we can end up tipping loads in the bowl and you can end up with 20 or so plus grams of sugar. Alright, now sugar is a really great catalyst for our skin and our skin problems, okay? So sometimes I can see from your diet you do have a very high sugar content, so the drinks, so the sugary kind of soda drinks, and also the sugary coffees, you have sugar in your tea. There's a lot of sugar going on here. So normally in this case I would recommend just cutting out sugar completely to see if there's a difference. And I imagine your flare-ups are occurring based on what you eat sometimes as well. So after you've had a big meal, you've been out, yeah. So you really need to be watching what you're eating. So you need to be reducing your dairy intake, I would say, especially these fatty spots up here. Yeah, they can be triggered by that. I would also say, again, if you're not going to cut out sugar, reduce it. So try using things like sweeteners if you have to have that sweet kick, or just try your best to go at least sugar-free with the sodas and also sugar-free with your teas and coffees. Yeah, I mean, you know, things like the sauces that you like, they are so full of sugar, so full of sugar. And then for some of the dinners, again, quite high fat content. So I'm not seeing a lot of really fresh produce. So, and I'm not seeing any water intake. You don't like water, okay? So, have you seen those water bottles which contain the little inserts and you can pop in fruit and stuff? Yeah? So get one of those. It will just infuse the water a little bit, but still help you with that intake. Okay, so we're gonna get one of those bottles. I'm just gonna note this down because we will have a review session, obviously. And water is also going to help with, you know, the plumpness of your skin, how fresh it feels. So it's something that you should definitely try and do. Okay, so that is my assessment so far. What I'd like you to do is to go away and don't panic and think, oh God, I've got to remove the sugar, I've got to drink more water, I've got to change my cleansing routine. Just think about each thing separately. Everything that you're putting into your body to eat or drink is going to have an effect on your skin. So just be mindful of that. When it comes to hygiene, just make sure that you're cleansing your hands, keeping them nice and clean. And then once it comes to any spots, we're going to try just a very stripped back routine just to see how the skin reacts. Okay? So do you have any questions? Yeah, absolutely. So if you're a little bit concerned, I would start with the blended tea tree oil. Okay. Again, with these types of products, if it's the first time you're using them, do not apply it all over your face. Treat it a little bit as though you're doing a patch test. When you have to dye your hair or anything like that, you need to do a 48-hour patch test. So apply it to one spot and just see how your skin reacts over the next day or two. If it's fine, you're not seeing any signs of irritation, try it on the rest of your skin and your spots. Don't go all in and just cover your face. Okay? Is there anything else? Yeah. So the assessment, we'll have a look again within sort of, I'd say around a month. We could look again within 2 weeks, but really a month is going to give us a good amount of time just for you to adjust your skin routine and flush out your system, hopefully with some water, and we'll see how it reacts. Yeah. No, it's a pleasure. Definitely. No one has the perfect skin. We all have skin problems. I've got some spots today, and I know that that's due to a bit of stress. As long as we can try to find the root of the problem, then that's how we can learn how we can manage them. Okay? But your journey to, healthier skin starts here, and together we can work on any other issues you're having. Okay? It's a pleasure. No, it's been lovely to meet you, and I will see you in a few weeks then. Okay? If you'd like to head out to reception, okay, just through that door, and you can make your appointment at a time that suits you. Yes, I'm always here, so it's not an issue. Okay? Wonderful. Enjoy the rest of your day then. Okay, you may have to, I don't know if you've got an umbrella with you. I think it's raining outside. Yeah, I know. Anyway, enjoy the rest of your day. Okay, don't worry, we're going to get all this sorted. Alright, I'll see you soon then. Bye. Right, so that's a reassessment. I imagine that'll be within 1 month. So we just need to review the water intake and the rest of the diet changes to see the effect, specifically on the spots in the zones there and there. And then also to see if any stress management has been done and the effect on that zone. And what else is it? Yes, to see if the flakiness has cleared up and the red irritation has reduced. Great. Okay, time for my next